Hi, my name is Hannah. I am a pharmacist currently working with the Women's Medicine Collaborative Primary Care Team, and I am here to teach you how to prepare and administer heparin injections. Heparin is a blood thinner used for the prevention and treatment of blood clots. Heparin vials come in different strengths and are measured in units per ml. Pictured here are the different strengths of heparin vials. Heparin is given as an injection under the skin. The preferred site of injection is the abdominal area. Injections must be given at least 2 inches away from the belly button. Alternate sites include the thighs or buttocks. Rotate injection sites and avoid injecting into an area that is bruised, swollen, or tender. Heparin is injected into the fat layer under the skin. In order to prepare for your heparin administration, you will need a few of these items listed: alcohol swabs, heparin vial, syringe, and sharps container. You may use an empty laundry detergent container or heavy-duty household plastic container if not provided a red sharps container. Pictured here on the slide are the items you will need. Next, I will give you a brief tutorial on how to draw up the heparin syringe and administer the heparin injection. First, be sure to wash your hands with soap and water and allow them to dry. You will first start by removing the plastic topper on the vial and wipe the rubber top of the vial with an alcohol swab and let it dry. Be sure to know the proper dose of heparin you are taking prior to drawing up the syringe. Take the cap off the plunger and draw back the plunger to put as much air in the syringe as the dose of medication you will be drawing out of the vial. To do this, you may need to remove the cap from the needle. Once you have drawn up the air, you will put the needle through the rubber top of the heparin vial and push the plunger to inject the air into the vial. This helps stabilize the pressure in the vial. Keep the needle in the vial and turn the vial upside down until the tip of the needle is in the liquid and begin to pull back the plunger to draw up the correct dose of heparin into the syringe. For the purpose of this example, I will be drawing up the syringe to 1 ml. Check for large air bubbles. Tap the syringe to push the bubbles to the top where you can push the bubbles back into the vial and continue to pull the plunger to get the right dose. When there are no obvious air bubbles, remove the needle from the vial and carefully place it down where it does not touch anything. If you are not going to administer the shot immediately, carefully recap the needle. If, for some reason, the needle bends, do not try to straighten it. Begin with a new needle and dispose of the needle in a sharps container. Before you begin, wash your hands with soap and water and dry them well prior to administering your injection. Choose your injection site. The preferred injection site is the abdominal area, given at least 2 inches away from the belly button. Alternative sites include the thighs or the buttocks. The site you choose for the injection should be clean and dry. Clean the skin over the injection site by wiping the area with an alcohol swab and allow the skin to dry before administering the shot. Remove the cap from the needle and gently pinch the skin at the site of injection. Hold the syringe in a dart fashion and insert the needle directly into the skin at a 90-degree angle, just into the fatty layer of the skin. Push down the plunger slowly as far as it will go. When all of the heparin is injected, slowly withdraw the needle at the same angle at which it entered and release the skin as you withdraw. Place the needle in the sharps container and use a cotton ball or gauze if necessary if bleeding occurs. Do not rub or press on the injection site. There is no need to recap needles prior to disposal. Be sure to remember to rotate injection sites. Take your shot around the same time each day. Store Store this medication at room temperature in its original packaging, away from excess heat, light, and moisture. And if you miss a dose, take it as soon as you remember, unless it is almost time for your next dose. If this is the case, skip the missed dose and resume your normal dosing schedule.